picture this.
Yeah.
You're lying back in like a sleek, brightly lit aesthetic clinic. You've just paid thousands of dollars for a cutting-edge regenerative skincare treatment.
Oh, yeah. The excitement is real.
Right. The practitioner is holding a tiny vial of what is essentially cellular magic. I mean, a serum designed to reverse the clock on your skin at a molecular level.
Exactly.
So they perform the injection and then, well, you feel it, a cold little trickle running right down your cheek.
Ugh, the absolute worst.
That is your extremely expensive, highly advanced serum simply leaking back out onto the surface of your face.
It is a devastating feeling, honestly, both for the patient and the practitioner.
I can imagine.
Because when you're dealing with advanced biologics, every single drop is incredibly valuable. And the culprit, it's not a bad needle.
No.
No, it's just basic fluid dynamics. The core problem is that we often think of the skin as an empty container, just waiting to be filled.
Right, like a water balloon.
Exactly. But in reality, injecting fluid into the dermal layers is like trying to force a fragile payload into a highly fortified, densely packed biological vault.
Which brings us to our mission for today's deep dive. We are unpacking the highly debated physics of tissue injections for you.
It's a surprisingly controversial topic in the field right now.
It really is. Specifically, we are looking at the critical choice between using 1.8 milliliter versus 3.0 milliliters of a diluent fluid to reconstitute these treatments. Specifically, lyophilized exosomes.
Yes, the exosomes are the key here.
Right. We want to find out which volume actually achieves the perfect physical balance. Like, how do you get that beautiful tissue turgor, that plumping and hydration, and get the exosomes to disperse properly?
All without causing so much internal pressure that the skin just hits its limit, right?
Exactly, and forces the liquid right back out onto your cheek.
It is a fascinating biomechanical balancing act. You are constantly fighting against the skin's natural architecture. So to win that fight, you have to manipulate the volume and the velocity of your delivery vehicle perfectly.
Okay, let's unpack this. Before we try to breach the vault, we need to understand exactly what our payload is and, well, why the volume of the liquid carrying it is even up for debate.
Sure.
We're talking about exosomes. And for those keeping track at home, these are microscopic intercellular communication vesicles.
They are astonishingly tiny. We're talking ranging from 30 to 150 nanometers.
Wow.
To put that in perspective for you, that is less than 1/1000th the thickness of a single human hair.
That is almost impossible to visualize.
It really is. They function as microscopic instruction manuals. Exosomes are not actual cells themselves. They are just the packages that cells use to send information to one another.
Oh, interesting.
Yeah, they carry payloads of growth factors and microRNAs. When they reach an aging or, a damaged fibroblast in your skin, they essentially drop off a new set of blueprints.
Like a software update for your cells.
Precisely. It instructs that old cell to start synthesizing fresh collagen and elastin, just like it did when it was younger.
But to get those blueprints into the clinic in the first place, they have to undergo a process called lyophilization.
Yes, freeze drawing.
Right. They're dehydrated by 98% in a negative 40°C environment.
Which is extreme, but taking the water out is an absolute necessity for their survival.
Because they're so fragile.
Exactly. Exosomes contain very fragile mRNA. If they were simply left floating in a liquid state at room temperature, well, biological enzymes would degrade that mRNA within hours.
So they'd be useless before they even reach the clinic.
Right. The extreme freeze-drying process halts all enzymatic activity and preserves that delicate internal architecture. But to actually use them on your skin, they have to be woken up.
They need a liquid.
Yes, they must be reconstituted with a liquid diluent.
And this is where the massive debate in the medical aesthetics community starts. Because the clinical guidelines for how much liquid to mix these with, they range wildly.
They really are all over the map.
Some protocols suggest using a tiny 25 microliters. Others demand a massive 3.0 milliliters of diluent.
What's a huge difference?
Right. If you use 1.0 milliliter, you get this highly concentrated dose in the syringe. But a protocol like the 2XOMe system uses 3.0 milliliters. That provides way more carrier fluid, and it's often blended with hyaluronic acid.
Which is a crucial detail, yes.
So my question is this just like making coffee? Does using 1.0 milliliter give you a highly concentrated, powerful espresso shot of exosomes, while using 3.0 milliliters dilutes them into a weaker, watered-down latte?
What's fascinating here is that the coffee analogy completely breaks down when we look at the cellular level.
Oh, really?
Yeah, it is not about diluting the potency of the active ingredient at all. It is entirely about providing a delivery vehicle.
Okay, go on.
The exosomes themselves, those billions of tiny vesicles, they don't change their individual potency whether they're floating in 1.0 milliliter or 3.0 mils of fluid.
Because they're discrete packages.
Exactly. The fluid volume fundamentally alters how those exosomes are able to physically travel through the dense layers of human skin. The fluid is the transport mechanism.
So the fluid is like the getaway car, and the skin is the terrain we have to navigate.
I like that analogy.
Let's look at that terrain then, because what physically happens when either 1.0 or 3.0 milliliters of liquid actually hits the dermal layers is just wild.
It is.
You mentioned earlier the skin isn't an empty container. The sources describe it specifically as a dense, poroviscoelastic matrix.
Yes.
It sounds like, I don't know, a cross between a memory foam mattress and a tightly woven biological sponge.
That's actually a great way to picture it. The tightness of that weave is what causes a phenomenon described in intradermal injection studies as the puddle versus bleb.
The puddle and the bleb.
Right. When fluid is forced into that dense matrix, it doesn't just sit there perfectly spherical. The bleb is the visible dome-like bump that distends outward on the surface of your skin right after the needle goes in.
It looks quite a bit like a mosquito bite.
Right. Exactly like a mosquito bite. But the puddle is what's happening underground. It's the actual lateral horizontal dispersion of the microscopic cargo beneath the surface.
Okay, I was looking at the fluid dynamics data in our notes, and it highlights something deeply counterintuitive.
About the dispersion.
Yeah. Smaller particles, like our 30 to 150 nanometer exosomes, they diffuse much further and deeper into that invisible subterranean puddle than larger molecules do.
Right.
And that happens completely regardless of how massive that visible bleb on the surface is.
Yes, the bleb size simply does not correlate to the puddle size when the particles in question are that minute.
That's crazy.
The exosomes are so small they can slip through the microscopic gaps in the tissue, migrating far beyond the visible boundaries of the original injection site.
Wait, if the exosomes are so tiny that they can just slip through the tissue and spread easily on their own underground, why not just stick with the 1.0 milliliter volume?
I see where you're going.
Right. You would minimize those ugly, visible blebs on the patient's face, keep the localized volume low, and the tiny exosomes would still slip through the cracks and do their thing. Why force a massive 3.0 milliliters of liquid into someone's face if you don't have to?
It comes down to the unforgiving physical limitations of the skin's collagen lattice. The exosomes are tiny, yes, but the skin's collagen network is incredibly restrictive.
How restrictive are we talking?
Well, the natural pores within that dermal lattice are only about 80 to 100 nanometers wide.
Oh, wow. Which is right in the middle of our exosome size range of 30 to 150 nanometers?
Exactly.
So it's not just a tight squeeze, it's an actual physical barrier for the larger exosomes in the vial.
Precisely. Many of the most potent exosomes simply would not make it through those tiny 80 nanometer gaps. They would just get trapped near the injection site.
That defeats the whole purpose.
It does. And that is where the larger 3.0 milliliter volume becomes a mechanical necessity. It isn't just extra water. It is a tool used to create targeted hydrostatic pressure.
Hydrostatic pressure.
Right. When you inject that larger volume, the sheer physical pressure of the fluid expanding inside the tissue actually stretches the collagen fibers to 2.1 times their original resting size.
2.1 times?
Yes. You are physically propping open the pores of the matrix.
So you are basically taking a narrow, restricted dirt path and bulldozing it into a multi-lane freeway.
Exactly.
So the entire payload of exosomes can get where they need to go. That makes a lot of sense.
It's all about clearing the path.
But a newly bulldozed freeway is useless if the cargo gets destroyed on the journey. How does this massive influx of fluid actually protect the exosomes while they travel?
This is where the specific formulation of the 3.0 milliliter diluent becomes crucial. In systems like 2XSME, that 3.0 milliliter fluid isn't just sterile saline water.
Right, you mentioned hyaluronic acid earlier.
Yes, it is packed with 10 milligrams per milliliter of non-cross-linked hyaluronic acid, or HA, along with various biomimetic peptides.
Let's ground those terms for a second. The biomimetic peptides are basically synthetic proteins engineered to mimic the body's natural healing signals. acting as an extra biological boost.
Correct.
And the hyaluronic acid is structurally vital because HA molecules carry a negative electrical charge.
And that charge is incredibly powerful.
Right. This ionic charge allows just 1 single gram of HA to forcefully pull in 1,000 grams of surrounding water.
When that powerful negative charge is introduced inside the skin, it generates a massive localized osmotic pressure.
Osmotic pressure is essentially like the biological equivalent of a vacuum pulling moisture across a membrane, right?
Yes, exactly. We were talking about the pressure surging from a baseline of 300 up to over 450 milliosmoles per kilogram,
Wow.
and that happens within just 90 seconds. This intense gradient forces the tissue to rapidly absorb moisture from the surrounding microvasculature.
Wait, pulling in 1,000 times its weight in water directly from the surrounding blood vessels inside the confined space of the face?
Yes.
I mean, that has to create a massive amount of internal physical tension.
It does, and it creates a beautiful structural firmness known as tissue turgor. The ultrasound data demonstrates that this osmotic pull causes the skin across the entire treated area of the face to physically thicken by 0.2 millimeters.
I know 0.2 millimeters sounds tiny on paper, but in terms of facial skin, what does that actually look like in the mirror?
It was enough structural expansion to completely push outward and smooth out those 0.5 millimeter deep fine lines, wrinkles, and acne depressions from the inside out.
That's incredible.
But purely from a cellular delivery standpoint, that 3.8 milliliter volume of HA essentially acts as a liquid artificial sebum membrane.
Oh, so it keeps everything lubricated.
Exactly. It hydrates the tissue so thoroughly that it allows the exosomes to tunnel through those newly stretched microchannels without drying out and dying before they reach their target cells.
Okay, let's visualize this. Imagine a dry, cracked riverbed. If you drop a handful of fish, which are our exosomes, onto that dry riverbed, which is our 1.0 milliliter approach, they're going to get stuck in the cracks and rapidly dehydrate.
A sad image, but accurate.
Right. But if you flood that riverbed with a larger volume of water, the 3.0 milliliters of HA, the riverbed swells, the cracks fill, and the fish have a hydrated medium to actually swim downstream to their destination.
If we connect this to the bigger picture, that deep hydration isn't just about facilitating transport or making the skin look plump for a few days.
There's more.
Oh, yeah. That 3.0 milliliter volume is actively defending the biological workspace. When the tissue reaches that level of turgor, the sheer density of the water molecules actually refracts and scatters incoming ultraviolet light within the dermis.
It acts like sunscreen.
Literally. It cuts UV penetration by 30%. This protects the fragile elastin fibers from photo damage, while the exosomes are busy going to work rebuilding the collagen. The delivery vehicle provides an active shield for the biological construction site.
Okay, so we have bulldozed the freeway, we have flooded the river to keep the cargo alive, and we've even set up a UV shield. It sounds perfect.
Does, doesn't it?
But, as with all things in physics, every action has an equal and opposite reaction. If we force this much fluid into the body's fortified vault, the alarms are going to go off.
Yes, the mechanical limits.
We have to talk about the pressure penalty. That brutal battle between getting enough dispersion and causing massive tissue displacement.
This brings us back to the skin being a poro-viscoelastic matrix. It has strict mechanical limits. Viscoelastic materials resist rapid deformation but will slowly yield to sustained, gentle pressure.
Okay, so it needs time to stretch.
Right. The skin can easily accommodate a few hundred microliters of fluid by stretching to form that bleb, but as the localized fluid volume approaches 1.0 milliliter in a single isolated spot, the tissue's elastic resistance hits a wall and the internal pressure spikes dramatically.
And the viscosity, the actual thickness of the fluid, makes this even harder. Products like AC Plus have a viscosity of 12 centipoise.
Right.
And normal saline is around, 1 centipoise. So you're trying to push a thick, syrupy gel into an incredibly tight space.
It's extremely difficult.
The sources highlight that the speed of the injection is the ultimate deciding factor here. If a practitioner tries to rush the procedure and injects faster than 0.5 milliliters per second, it triggers a cascade of failures.
A total cascade, yeah.
It creates 28% higher tissue back pressure. The vault rejects the payload. That high back pressure leads to 17% of the drug leaking right back out of the puncture site, running down the patient's cheek.
Which brings us back to your very first point.
Exactly. Plus, it causes 22% more pain as the tissue is violently forced apart.
The pain and the visible leakage are certainly problematic, but the invisible damage happening at the cellular level is far worse.
Worse than the leaking.
Oh, absolutely. Pushing that thick, viscous fluid too rapidly generates internal shear forces exceeding 45 dynes per square centimeter.
Dynes per square centimeter. So we are talking about literal mechanical friction here, like trying to force a thick, heavy milkshake through a tiny plastic coffee straw. Yeah. The pressure doesn't just block the flow. The intense friction actually ruins the physical structure of the liquid itself.
Yes. The friction of the fluid moving violently against the walls of the needle and tearing through the tight collagen network generates so much mechanical shear stress that it physically shreds the delicate lipid bilayer membranes of the exosomes.
Oh, no.
You are literally destroying the medicine by pushing it too hard. The clinical data shows that tearing those membranes reduces the drug's bioavailability by 18%.
That is a massive loss.
It is. The absolute maximum flow rate, the Goldilocks zone, is a very slow, deliberate 0.25 milliliters per second. That precise speed maintains a safe hydrostatic pressure of 35 to 50 millimeters of mercury, allowing the viscoelastic skin to slowly stretch without tearing the exosomes apart.
Here's where it gets really interesting. We have this massive inherent conflict.
We do.
We desperately want the benefits of the 3.0 milliliter volume. We need that tissue turgor, we need the bulldozed hyaluronic highway, and we need the UV protection.
Right.
But if we try to push all of that fluid into the skin, the massive back pressure either spits those incredibly expensive exosomes right back out, or the shear friction destroys them entirely.
This raises an important question. How do we safely deliver 3.0 milliliters of a thick, viscous fluid into the face without triggering that devastating pressure penalty?
Microdosing, right?
Exactly. The engineering solution is microdosing. You cannot simply take a syringe and blast 3.0 milliliters into one spot on the cheek. You have to distribute that total volume across the entire surface area.
How many points are we talking about?
The advanced protocols call for 150 to 200 individual microinjection points, delivering a microscopic 0.01 to 0.02 milliliters per single point.
Wow. And practitioners do this using specialized multi-needle vacuum devices or, very precise microneedling stamping techniques. It's a divide and conquer strategy.
Perfectly said.
It keeps the localized pressure at every individual puncture site incredibly low, safely below that 45 dyne shears stress threshold. But cumulatively, across the entire face, you still inject the full 3.0 milliliters to achieve that beautiful full-face tissue turgor.
By spreading the total volume out across hundreds of tiny, slow drops, you respect the viscoelastic limits of the skin. You give the matrix time to yield while still providing enough total fluid to stretch the collagen lattice and construct that exosome highway.
So bringing all of this evidence together, let's give you a clear, definitive verdict on the great 1.0 mil versus 3.0 mil debate. Which one actually wins?
The 1.0 milliliter diluent definitely has a specific, highly targeted role. It is the optimal choice for highly localized, hyper-concentrated treatments in delicate anatomical zones.
Like around the eyes.
Yes. For example, the skin directly under the eyes is exceptionally thin, measuring only 0.3 to 0.5 millimeters thick. It is highly prone to persistent edema or pooling of fluid.
Because if you pump 3.0 milliliters of highly hydrophilic hyaluronic acid into the thin skin under the eye, it's going to pull in 1,000 times its weight in water.
Exactly.
And you're going to leave the patient with a puffy water balloon under their eye for a month.
A terrible outcome.
So the 1.0 mil volume requires significantly less total mechanical force, which is far safer for delicate skin, but you knowingly sacrifice that widespread structural turgor.
On the other hand, the 3.0 milliliter diluent is undeniably the superior choice for overall full-face rejuvenation. It provides that optimal tissue turgor and widens the dermal pathways.
It's a whole package.
Furthermore, if the practitioner is using a mechanical microneedling device, like a 16-array MTS device that creates 200,000 microscopic puncture channels in the skin, that 3.0 milliliter HA solution acts as a vital physical lubricant.
Because doing that dry would be awful.
Doing that procedure dry or with too little fluid causes micro-tearing in the epidermis. The larger volume ensures the needles glide smoothly, preventing unnecessary inflammatory damage.
And here's a massive point for the 3.0 mil side. The sources show that fully blending the exosomes with that larger volume of HA actually extends the viability of the exosomes on the shelf.
That's true, yes.
It coats and protects them, extending their lifespan from just 4 hours up to 12 hours at room temperature before they degrade.
A huge practical benefit.
But the crucial caveat, and you have to remember this if you're ever sitting in that clinic chair getting this done, is that the 3.0 milliliters must be delivered slowly evenly and spread across hundreds of points.
Absolutely essential.
If your practitioner is rushing, you are going to hit that pressure penalty. To summarize it simply, 1.0 milliliter is your precision sniper rifle for those delicate, thin-skinned areas where volume is the enemy.
Right.
And 3.0 milliliters is your sprinkler system for the entire lawn, making sure the entire network gets hydrated and treated, provided you don't turn the water pressure up too high and flood the grass.
I think the sniper rifle versus sprinkler analogy perfectly captures the mechanical reality. Ultimately, the choice depends entirely on matching the fluid volume and the specific injection tool to the exact anatomical depth of the target tissue.
It's all about precision.
The skin is a complex three-dimensional vault. Mistargeting your injection depth by even a single millimeter can mean the difference between triggering incredible cellular regeneration or just washing the expensive serum away.
So to recap for you, exosomes are incredible biological messengers, but they absolutely need a carrier vehicle to navigate the skin's dense matrix.
Yes.
Using 3.0 milliliters provides excellent tissue turgor and physically bulldozes dermal pathways for the exosomes to travel, as long as it is injected at a slow velocity across hundreds of micropoints.
Exactly.
Using 1.0 milliliter minimizes localized pressure and displacement, making it the safer bet for thin skin, but it lacks those widespread hydration and UV protection benefits.
That's the trade-off.
So what does this all mean? We have spent this entire deep dive talking about the fluid volume as if it is purely a delivery vehicle. The getaway car just driving the main event, the exosomes, to their destination. But looking closely at the research, is there more to the story?
There is, and this is where the cellular science gets truly mind-bending. We have framed this entire discussion around the fluid acting merely as a transport mechanism and a protective shield. But the research notes that the simple physical act of expanding the tissue with that large volume of fluid exerts 15 to 20 piconewtons of tensile force on the local fibroblasts.
Wait, 15 to 20 piconewtons just from the skin physically stretching outward to accommodate the liquid?
Yes. The cells themselves are physically pulled and stretched by the expanding collagen matrix.
Okay.
And that specific mechanical stretching triggers an instantaneous spike in intracellular calcium within those fibroblasts. That calcium spike directly activates the pathways that promote natural collagen synthesis.
Wow.
So what if the mechanical stress and pressure of the 3.0 milliliter fluid stretching the skin isn't just a side effect of delivery? What if the physical mechanical act of stretching the cells from the inside out is actually a hidden active ingredient working right alongside the biological signals of the exosomes?
Wow. So the physical stretch itself is part of the medicine. The Volt's reaction to being breached is what actually triggers the healing.
It seems so.
That completely reframes how we have to think about aesthetic injections. It is not just about what you put into the tissue. It is about exactly how hard the tissue pushes back. I will leave you to ponder that concept next time you are marveling at fluid dynamics, or, well, hoping you never catch a stray drop of expensive serum running down your cheek. Thank you for joining us on this deep dive. Catch you next time.